Hello and welcome to our medicine philosophy. We're going to talk here about tetralogy of fallot. Firstly, we're going to go through definition for the tetralogy of fallot according to the Nelson for pediatrics. It's a congenital heart defect characterized by a combination of 4 anatomical abnormalities which lead to low oxygenated blood through the body, resulting in cyanosis. So the kid or the child will present to us as a bluish discoloration of the skin and cyanosed. These 4 abnormalities are ventricular septal defect, overriding aorta, pulmonary stenosis, and right ventricular hypertrophy. So we're going to ask ourselves an important question. Is it a real 4 defect? Is it really a 4 defect that's happening in the heart? It is a 4 opening? Actually, no, it's not. It's just one defect that leads to all these abnormalities. So we're gonna deep dive to this process and understand how it's happening. It's called the endocardial cushion defect. So it's a defect that happens in the endocardial cushion, which is the place where there is a proliferation, differentiation of the cell that will separate the heart into 4 chambers. Without these proliferation, without this mechanism, the heart cannot be separated and there will be no valve like mitral valve, tricuspid valve. It will be just one common way that's put the heart all together, Okay, so by this defect, there is a mechanism. That mechanism called EMT process, the epithelial mesenchymal transformation process. It is a process where there is a transformation from a cell type to other type, from epithelial type to mesenchymal type. And there is a huge difference between epithelial type and mesenchymal type by the tight junction between cell and another. So the cell and the epithelial type are just tied together. They are strong building, but the mesenchymal type are not. They lose their polarity. They have the ability to migrate, to differentiate, to fill the area. Okay, so this transformation from epithelial to mesenchymal cell type help the endocardial cushion to proliferate and septate the heart and generate these valves and have the 4 separate chambers. But with this process have a defect in its signaling maybe, or in the process itself. Of course, each process have a signaling pathway like TGF, WNT, beta-catenin, okay? So any defect in this pathway or this process will lead to endocardial cushion defect, and by that lead to tetralogy of fallot. For your information, you need to know that EMT, it's not just a normal process that happens in the embryogenesis or in the developmental stage of the fetus. It's also the process that the cancer cell used to differentiate and to migrate to metastasis by losing their polarity by migration through the blood cell, through the lymphatic vessel, and throughout the body to metastasis. Okay, so it's not just a normal process to differentiate. So the clinical features are quite obvious. Of course, we're going to have cyanosis, we're going to have death spells, which is when it's in a stressful condition like crying or agitating, it will be more cyanosed. We're going to have also a single S2. Obviously, you know that S2 is generated by the closure of aortic and pulmonary valve. We all know that the aorta is closed before the pulmonary valve, so there is a physiological separation or splitting between these two sounds, the S2 sound. But in this defect, there will be no splitting because the pulmonary valve closure will be delayed due to the pressure overload. We're going to also hear a pulmonary stenosis murmur, which is an ejection systolic murmur. And we can also palpate or even inspect the right ventricular impulse, depending on the severity, of course. The right ventricular impulse is that impulse generates because of the right ventricular hypertrophy. We can inspect it or palpate it in the left lower parasternal border. Also, the child will have a failure to thrive. The investigation can be simple like ECG, echo, X-ray. ECG finding will be obviously right ventricular hypertrophy, excess deviation to the right bundle branch block, wide QRS complex. In the echo, we can see the anatomical defect very obviously. In the X-ray, because of the anatomical defect, because of that abnormality, the heart shape will be like a boot shape. It will be different than the normal shape we see in normal X-ray. Some managements depend only on the presentation, or mainly on the presentation. We're gonna need symptomatic management, or may have palliative surgery, or complete repair surgery, depending on the age, on the severity, on the patient himself. For example, we have the squatting position for the symptomatic relief. This squatting position can lead to raise in the systemic vascular resistance in the left side, so the right to left shunt will be decreased, and by that we will relieve the cyanosis, especially in child with a TET spill. And that's it, all we got for this lecture. Keep wondering, stay curious. Here was Hanin Hussein by Medicine Philosophy.